Welcome everyone. So today we will discuss nature and scope of mental health nursing. So let's start with nature of mental health nursing. First, psychiatric nursing is a profession possessing its unique history, ideology, knowledge and skill. So psychiatric nursing is a profession which has its own uniqueness, knowledge and skills. Second, it provides services to individuals whose primary health needs are related to mental, emotional, and developmental problems, especially serious disorders and persistent disabilities. So, mental health nursing provides various services to individuals. So, it has people who have emotional, mental, and developmental problems, especially serious mental disorders. Third one, it is committed to the maintenance, promotion, restoration, optimum mental health for individuals, families, community groups, and society through the use of therapeutic relationship and intervention. So, it will maintain, promote, and restore mental health of an individual, family, and community by using the therapeutic relationship and interventions. Fourth one, psychiatric nursing is specialized area of nursing practice employing the wide range of explanatory theories of human behavior as its science and purposeful use of self as its art. So psychiatric nursing is a special branch that uses various theories of human behavior. It combines science and with art. So science means knowledge and art means how they care. So fifth one is psychiatric nursing is both an art and science. During actual practice, the art and the science of nursing are inextricable. The art of caring is professionally embodied in the therapeutic alliances that develop between the nurse and patient, and it's referred to as the nurse-patient relationship. The alliance is a vehicle for the patient to learn and practice skill for the purpose of gaining insight, affecting change, healing mental and emotional wounds, and promoting growth. So, psychiatric nursing is both an art and science. The art means caring for patients, and science is use of principles of nursing. The alliance is a vehicle for the patient to heal mental and emotional wounds and promote growth. So sixth one is the science of psychiatric nursing includes understanding and use of principles of nursing on all levels. So the science it includes understanding and use of the principles of nursing in all levels. 7. In addition, there is a required commitment to remain current in knowledge and to practice all the learned skills and procedure that ensures patient safety and well-being. So, mental health nurses must keep learning new things. So, they stay up to date. They need to be committed to improve their knowledge and skills. So, next we'll see scope of mental health nursing. So, role of the generalist. So, the psychiatric mental health generalist is that she is the licensed registered nurse and she will deliver mental health care. She will look after both physical and mental health care. Okay. Then next is that is role of the specialist. This psychiatric clinical nurse specialist will be there. She will be having master's degree in psychiatric mental health nursing. Then this clinical nurse specialist is the primary healthcare provider. She provides care to the people with emotional and psychiatric problem. So next is community mental health nurse. So community mental health nursing is applications of knowledge of psychiatric nursing in preventing, mental analyzing, promoting and maintaining mental health of the people. It includes early diagnosing, appropriate referral care and rehabilitations of mentally ill people. So community mental health nurse uses psychiatric knowledge to prevent and manage mental illnesses in the community. They will focus on early diagnosing, referral and rehabilitation. So next is psychiatric home care nurse. Home health care is one aspect of community health nursing. Psychiatric home care nurses provide holistic psychiatric nursing care on visiting basis to people needing assistance. This message provides comprehensive care including psychiatric and physical assessment, direct nursing care, behavior management, crisis intervention, psychoeducation, home detoxification, medication management, case management, and consultation with colleagues. So, psychiatric home care nurse, they will provide psychiatric care at home. They will help with physical and mental assessment, medication detox, then crisis management and counseling. Next is forensic psychiatric nurse. Forensic nursing is growing specialty in other countries around the globe, especially in UK, Australia, Germany, Japan and Canada, and it is expanded scope of practice. Forensic psychiatric nurse work with individuals who have mental health needs and who have entered the legal system. So this forensic psychiatric nurse, she will work with mentally ill people who are in the legal systems like jails or court cases. Then it is common in countries like UK, Australia, Japan and Canada. Like there is a more expanded scope of practice in these countries. Sixth one is psychiatric consultations, that is PCNN licensed nurse. So psychiatric consultations licensed nurse has arisen in response to increased recognitions of the importance of psychophysiological interrelationship and the impact on physical illnesses, recovery and wellness. It is an advanced practice nurse who practice psychiatric and mental health nursing in medical settings or non-psychiatric setting. So, the psychiatric consultation will be there. She will work in hospital and she will connect physical and mental care. Then she will manage psychological effect on physical illnesses. And it is an advanced practice of nurse who will practice psychiatric and mental health nursing in medical setting also and in non-psychiatric setting also. So next is case manager. So nurse case manager act as an advocate for the patients and family by coordinating care and linking the patient with physician and other members of healthcare team, resources and the peers. So this case manager, she will coordinate with patient care between different healthcare provider. Then she will act as an advocate for the patient and family. Next is geropsychiatric nurse. Nursing is expanding the psychiatric nurse practice to each people who have been affected by emotional and behavior disorders like dementia, chronic schizophrenia and delirium. So this geropsychiatric nurse cares for older adults with mental disorders like dementia, schizophrenia and delirium. So next is parish nurse. Parish nurse is another area expansion of psychiatric nurse role. Parish nursing is a program which promotes health and wellness of the body, managed spirit. This parish now is pastorally called spiritual mature license registered, not with a design to serve members and friends of his or her congregation. So this parish nurse, she will work in religious committees. She will promote spiritual, mental and physical wellness. Next is telehealth or tele-nurse. Nurses engaged in tele-nursing practice use technology such as internet, computers, telephones, digital assessment tools and telemonitoring equipments to deliver nursing care. So this nurse which are engaged in this telenursing, they will use technologies, new technologies such as internet, computers, telephones, then digital assessment tools also to deliver this nursing care. In India, around 10 hospitals are giving this telemedicine department like care. For example, Apollo Hospital is there, then Narayan, Rudalaya and Hosmat Hospital at Bengaluru. These job opportunities are available for telehealth nurses over there. So next is nurse researcher. Nurse researchers are the scientists who seek to find answer to the question through methodically observation and experimentation. So these nurse researchers, they are like scientists. They will find answer to the questions which arise among themselves. They will find answers to this by observation, by performing the experiment. They will find the answer. Like, they will conduct research to improve psychiatric nursing practices. Even they will share results in journals and meetings also. Then 12th one is psychiatric nurse educator. The psychiatric nurse educators work in educational institutions, staff development department of healthcare agencies, patient education department. Teach the mentally ill and their families about how to provide care at home. So this psychiatric nurse educator will be there. She will teach nursing students and staff. She will educate patients and families about the mental health care also. Then next is nurse administrator or manager. A nurse manager works less directly with patients but has responsibility to provide nursing leadership to ensure that an appropriate therapeutic milieu is maintained. So this nurse administrator or manager, she will manage and lead nurses, and she will ensure a healthy and safe environment. So next is psychiatric nurse as collaborative members of interdisciplinary team. So psychiatric nurses work together with doctor, therapists, social workers and other healthcare members as a team. So the psychiatric nurses will be there. They will work with other members like doctors, therapists, social workers and other healthcare members, and they will provide care. They share a common goal to give best care to the patient. So they share a common goal, and the common goal is to provide best and effective care to the patient. 15th one is nurse psychopharmacologist. A nurse psychopharmacologist is a psychiatric nurse with special training and authority to prescribe medications and manage the patient's treatment using psychiatric drugs. So a psychiatric nurse will be there, like psychopharmacologist. She will prescribe and manage psychiatric medications. So these are the scope of mental health nursing. With this, we'll end our video. Thank you for watching. Like and subscribe the channel.